Yeah. Can you just do a quick mic test to make sure?
Test.
Test. Okay. Look at that.
There we go.
Careful itself about the tech work.
Yeah, that's always important.
Test. Well, good afternoon, everybody. Thank you so much for being here. I'll call the special meeting of the Public Health and Safety Committee meeting to order. Today is June 28th. Really appreciate everybody being here. So today is our third and final special meeting of Council's Public Health and Safety Committee regarding safe schools and communities addressing the gun violence epidemic. I'm very thankful to all our Metro leadership for their time and efforts to engage with Council to help us towards providing the greatest level of support of this critical work. I'm pleased to report that our efforts with this meeting series have resulted in tangible results. Our first meeting that focused on MNPS and MNPD highlighted the need to support specific school safety initiatives of improved radio systems and ballistic glass, and that $6.5 million investment was able to be funded from this year's fiscal budget surplus funds to immediately begin the procurement process. Our second meeting at Hillsborough High School last week was a great start for Metro to build strategic partnerships, to join a coalition of partners to advocate for meaningful change here locally, at the state, and across the nation. My thanks to our Metro Public Health Department, Moms Demand Action Tennessee chapter, and the Uvalde Foundation for Kids for their participation. The work will continue to ensure we are doing everything we can here within our control and as advocates to keep our kids and our schools safe. Today's meeting is to focus more broadly on gun violence as a public health epidemic. Presenting before us today will be our Metro Public Health Department, our Metro Office of Family Safety, the Mayor's Office of Community Safety, and the Mental Health Cooperative. And I extend a special welcome and thanks to Aurora Vasquez, Vice President of State Policy and Engagement with the Sandy Hook Promise, for joining us here today. Our presentation today is a robust and revealing look at the current state of gun violence in our community and highlights the strong work already being done, but will also help us identify a strategic direction that Council can enact to pull together a synergized and cohesive plan to make Nashville a safer place for all. So with that, I'll hand it off to Dr. Gil Wright, our Chief Medical Director, who can introduce his team. And then as each presenter begins, I ask that they just introduce themselves and recognize any of their team members that are present. We'll then hand it off to council members for questions after that. Thank you, Dr. Wright.
Thank you. Chairman Syracuse, this is up. We appreciate the opportunity to present for this important topic. I have with me Colton McKay. He's one of my epidemiologists. He'll be doing some presentation on data in just a minute. Also want to thank Anthony Johnson and Rand Carpenter, two of our other individuals in the department, for putting the information together, as well as our partners for this presentation throughout Metro. There has been a rising loss of lives from mass shootings over the past 50 years. All this while the number of overall homicides was decreasing. In 1970s, deaths from mass shootings averaged 8 per year. In the 1980s, the average was 15 lives per year. In 1990s, the average was 21 deaths per year. In the 2000s, this increased to 24 lives a year. And finally, in the 2010s, unfortunately, we saw a sharp rise with an average of 51 lives lost per year. In 2019, a poll showed that 2/3 of adults say they cannot go anywhere without worrying about being a victim of a mass shooting. Also, more than 1/2 of American teenagers say they worry about a shooting in their school. The resignation shows some school children are adding a sticker to their ID or cell phones that reads, "In the event that I die from gun violence, please publicize the photo of my death." This does not have to be normal. Reasonable safety regulations are supported by a majority of Americans, yet even modest approaches continue to be prevented by partisan politics and gridlock. Prevention works upstream of the acute event to prevent an action. Intervention works to mitigate and interrupt the acute action. We need to maintain the current level of funding for intervention, while we also find funding for upstream prevention that can take years to see results. Children who have suffered multiple adverse childhood events, called ACEs, are at an increased risk. They are at increased risk of drug and alcohol abuse, poor overall mental health and physical outcomes, of decreased productivity as adults, of increased need for resources as adults, and are at increased risk of propagating the violence. COVID has led to increased feelings of isolation and mental health issues. It has also exposed some children to increased trauma. In our current system, it's easy to fall through the cracks. Providers and teachers aren't uniformly trained to recognize trauma or how to step in and help. Even if a child is screened, it doesn't mean they can access service due to barriers such as lack of insurance, lack of transportation, stigma of the treatment, and lack of providers. School screening of children can be easy, but what comes next isn't. Only 31 states mandate school counselors. Student counselors in schools average 1 per 444 students. The average school psychologist ratio is 1 to 1,500 students. The current recommended ratios by the American College of Counselor Association is 1 per 250 students and 1 per 500 students, respectively. All of this speaks to the increased need for mental health resources in our community and schools. Mass shootings are only the tip of the iceberg. The base of this iceberg are adverse childhood events, including significant loss, trauma responses, mental illness, especially in parents, neglect, and abuse. Next is violence in the home that the individuals may experience or be the victim of, and includes abuse, neglect, domestic violence, and sexual assault. The next area is other violence that may include weapons, such as guns, and include interpersonal violence, assaults, robberies, gang violence, suicides. Finally, the tip of this iceberg is mass shootings. It is important to understand that all of these types of violence interact with the other or with the others and are all of the same origin. Understanding the patterns of our lives for those who behave violently is important. The cycle starts with ACEs. These can be physical or sexual abuse or severe bullying. It can be exposure to unaddressed violence at a young age, often at the hands of parents. There are many other traumas that can scar a child. But childhood trauma alone does not explain or excuse shootings. Millions of children experience adversity or trauma without resorting to that. Next in the cycle is an identifiable crisis that occurs days, weeks, or months prior to the event. It could be the loss of a significant relationship or job, or an interpersonal conflict. That's followed by a feeling of marginalization and finding someone to blame. Many perpetrators have a script of sorts to follow. They simply have to look at the news and see other shootings. They admire these shooters and find someone or a group they feel is to blame for their circumstances. Finally, mass shooters must have the opportunity to act. This includes having access to firearms and to the people and places they find responsible for their grievances. The good news is that crisis intervention is a skill that anyone can learn. You don't have to be a doctor or a psychologist. Recognizing a crisis is simple for those that know the individual in crisis, but hard for those who don't. They have to be able to identify changes from baseline in that person's norm. The hardest part is actually knowing who to report it to and having the courage to do so. Much like suicide victims, a vast majority of mass shooters leak their plans in advance. In both cases, this is a cry for help, and intervention may be able to stop it. Before that point is reached, though, some things can help. Reducing bullying, providing counseling can significantly improve resilience to ACEs. Having a stable, committed relationship with a supportive adult is the single most common factor for children who are resilient in the face of trauma. In summary, mass shootings are preventable. They're not a way of life. MPHD looks forward to working collaboratively with other Metro partners to, in the near future, present detailed, unified recommendations to Council for further discussion and consideration. I'll turn it over to Colton.
Thank you. Good evening. My name is Colton McKay, and I'm an epidemiologist from Metro Public Health Department. I'm going to go over some general data points to help give context to the current landscape of violence, both nationally and here in Davidson County. We've compiled data from a number of sources, both internal to the health department and other Metro agencies, as well as other reliable research organizations. To begin, let's look at predictors of violence, or what does the data say are the most common characteristics for those perpetuating violence? Well, according to a number of sources, the greatest predictor of violence is a history of violence, be that as a victim, a witness, or a perpetrator of violence. And on top of that, the highest rates of gun violence are proportional to the accessibility of guns, meaning the states with the most access to guns have the highest rates of gun violence. Males are also overrepresented among violence perpetrators. Violence and fear of violence can cause trauma, toxic stress, and these contribute to mental illness. And we see that victims of violence are more likely to suffer poor mental health outcomes, so violence begets violence. Addressing mental illness is not just a short-term violence prevention strategy, but rather it's a strategy for healing those affected by violence and creating a more resilient community to affect downstream violence. Firearm injuries are becoming more common among children and adolescents, and the CDC notes that in 2020, firearms surpassed motor vehicle crashes as the leading cause of death for those under 19. While motor vehicles have become safer, resulting in a decline in deaths from car crashes, it still remains clear that firearm-related deaths among our kids by homicide, suicide, or unintentional injuries are on the rise. Now we'll move on to some more local statistics. MMPD reported 87 fatal shootings in Davidson County for 2022. There were also 384 violent crimes that resulted in a gunshot injury. And so far this year, MMPD reports another 46 fatal shootings and 172 non-fatal shootings. In 2020, CDC Wonder determined that Davidson County was ranked 16th highest for gun violence incidents per capita among similarly sized metro areas. From data reported by the Office of Family Safety, we can see that domestic violence is also a threat in Davidson County. There were 18 domestic violence murders reported in 2022, and half of which were by firearm. They also report that domestic violence offenders are 5 times more likely to kill their victim if they own or have access to a firearm. Additionally, 36% of domestic violence murders were perpetrated by a person with a previous felony or domestic violence conviction. According to the Tennessee Department of Health, data from 2019 shows suicide deaths in Tennessee are most commonly attempted by firearm at 62%, while other methods like hanging or poisoning make up the remaining 38%. This proportion is different from what we see nationally. About 53% of national suicide deaths were by firearm. What makes this data point concerning is the lethality of firearm suicide attempts. Someone attempting suicide by firearm will die 85% of the time, compared to only 4% by other methods. This lethality is even more dire when considering the impulsivity of suicide. In a report from Harvard, it was found that in a study group of 13 to 34-year-old participants, for those that admitted to attempting suicide, 24% had made that attempt within just 5 minutes of their first suicidal ideation, and 70% within the first hour of suicidal ideation. This gives some context to the association between gun access and risk of suicide reported by the American Foundation of Suicide Prevention, a 2 to 10 times greater risk of suicide when having a gun in the home. This concludes the data portion of our presentation, and I'm happy to provide links to these resources for more detailed data or learning opportunities after the conclusion of the total presentation. But I will now step aside for Mental Health Co-op to begin the next portion of the presentation on what resources we currently have available in our community. Thank you.
Thank you both very much.
Good afternoon. I'm Adrienne Lavati. I'm Vice President of Emergency Psychiatric Services with Mental Health Cooperative here in Nashville, Davidson County. Mental Health Cooperative was created in 1993 as a service needed to address individuals with severe and persistent mental illness. We were established by the Department of Mental Health and Substance Abuse, looking at the complex needs of individuals who experience mental illness. The priority population that we do work with are individuals who are covered by Medicaid, Medicare, or we have state grants that allow us to be able to provide services for people who are uninsured. Mental Health Cooperative is designated as the crisis service provider for Davidson County by the Tennessee Department of Mental Health and Substance Abuse Services. In July of 2022, United States entered into a whole new time of being able to provide a 3-digit number for people who can call in any form of mental health crisis. That number is 988. In Tennessee, those calls can be routed to a local center for the National Suicide Prevention Lifeline. And just like 911, when someone calls 988, they are able to access resources for connecting people to the right treatment and the right time and the right setting. Once those calls are funneled into Mental Health Cooperative through other agencies within the city and state, we are able to provide a mobile crisis team who can go out into the community, go into emergency rooms, go into the jail system, and be able to assess those individuals who are in some form of mental health crisis to then link them into other services. So here's a little bit of how our crisis system works within Davidson County. When someone is in crisis, they are like I said, they're assessed by our mobile crisis team, and there are definitely different ways that they can then link into services. One is through linkage into outpatient. Sometimes that's what someone needs, is connecting them with outpatient services, which we do offer at Mental Health Cooperative, as well as other agencies within Nashville. We have several different crisis units that I'll go into in a minute and tell you more about that are within our campus over in Metro Center, where we can offer a program for people who can stay with us for a couple days, work on getting stabilization, and then back out into the community and back into outpatient services. There are times when the individual refuses crisis services, so then a treatment plan is made with that of what needs to happen from there. And then at the extreme, we do at times have to hospitalize someone because their crisis is to the point where they need an inpatient stay, and we can link them into that resource as well. This first image is our crisis treatment center. This is our 23-hour walk-in center. Again, we are located over in Metro Center. We have observation beds here, and people can come in and get the level of service that they need. So there's 24/7 nursing care. We have providers, both nurse practitioners and physicians, that see people on a daily basis. We have groups that are led by some of our staff, resident counselors, peer support, and then we have individual discharge planning for each person that comes into our facility so that we can make sure that their needs are met once they discharge, and hope to break the cycle of them coming back into our services. But again, we're always there if needed, but we're trying to get them back out into their life. This is our 15-bed crisis stabilization unit, also located on our same campus. Again, like I said, there's 15 beds. We have 24/7 nursing care. providers are seeing these people every day as well, nurse practitioners and physicians. We also have a medical provider that can come in for physical health needs. We offer 4 groups on this unit. We also have discharge planning to individualize that care for that person who's in our services. And then if someone is in our program and we're thinking they're really not improving or we need to reevaluate them, our mobile crisis team is also housed within our same facility and can come reevaluate them and see if they need a different level of care. So the involuntary commitment was when I referred to hospitalization. So within this, there are certified people who can make this determination of being able to admit someone into a psychiatric facility. The person has to have a mental illness or serious emotional disturbance, and a person poses an immediate risk to themselves, and this is called a 6404. So these people are then, a 644 is completed. It's evaluated if they were able to, since they were not able to be successful in terms of their mental health treatment on an outpatient basis or in one of our treatment programs, then it's looked at placing them into an inpatient facility here within Nashville. I'll turn it over to Michael.
Hello, my name is Michael Randolph, and I'm the program manager of our Partners in Care and REACH programs. I want to talk to you a little bit about our crisis services. So Adrian touched on our traditional mobile crisis service. Mental Health Cooperative operates a 24/7 crisis line where individuals or families can call in if they need a face-to-face assessment in a mental health crisis. These crises can include a suicidal crisis, any sort of threat of hurting themselves or others, any sort of psychosis, which could be delusions or hallucinations, and any sort of interference of self-care from a mental health disorder. But in 2021, we launched our pilot program for Partners in Care. That's a program where we team up master's level clinicians with police officers at the precinct level to primarily respond to mental health calls and also respond to other calls and try to help out where we can. We've expanded since that time to Central, Hermitage, Midtown Hills, North and South Precinct, which are our busiest precincts. All of our expansions are data-driven, and we will be expanding to Madison, in August, and the rest of the city by the end of next year. Partners in Care has had around 3,300 total crisis events since the inception of the program, and about half of those needed a full crisis assessment, which means they were actively suicidal or experiencing psychosis to the point where they needed an intervention. In Valentine's Day of this year, we launched our Responders Engaged and Committed to Help program, which is our REACH program, which is our partnership with the fire department to answer nonviolent mental health calls with a paramedic partnered with a master's level counselor or social worker. In the first quarter of REACH, we saw 150 assessments done, and there are currently 2 REACH teams operating Tuesday through Friday, 10 a.m. to 8 p.m. Our Partners in Care operates Monday through Friday from 6 a.m. to midnight, and again, all of those are data-driven to try to be available for the most crisis calls that come in. When a crisis happens, we try to link someone with continued support in outpatient services. At Mental Health Cooperative, we really want to support and coordinate the mental, physical health care of consumers to improve access to care and outcomes and quality of life for that consumer. Our community-based care managers, our bachelor's level, our master's level social workers who provide social support, link consumers with care, and collaborate with providers across all of our services. They work hand in hand with our prescribers, which is psychiatrists or nurse practitioners, who also work with the consumer and their care team to provide quality, holistic care. Behavioral health, physical health, and addiction providers all work together to close any gaps in care for those consumers in our services. Our nurses provide patient education and vital education to care managers, which allows Mental Health Cooperative to close gaps in care such as diabetes screenings and metabolic monitoring for really good wraparound services for anyone in our outpatient services. We also have specialized teams, such as our homeless outreach team, and those are specialized case managers that meet the unhoused where they're at and try to link them with mental health or substance abuse services and housing resources. We also have our first episode psychosis team who worked with families and individuals who've had their first episode of psychosis and work with those families and that person to link them with the best care they can. We also have our transitional youth team who helps people who've kind of grown up in our youth services to transition into adulthood. We also have school-based mental health services and school-based therapy that is not currently in all schools, but there are plans to expand. It would be remiss without mentioning our other big community partners in the mental health field. Centerstone Community Mental Health Services, Youth Villages has services for those 18 and under, Park Center, and of course Vanderbilt. All of our organizations work really well together to hopefully serve all the citizens of Nashville and meet the mental health care needs. With our co-response programs and our crisis continuum, collaboration is essential to improve access to mental health care for Nashvillians and have a great crisis system here. So we work really well hand in hand with the police department, the fire department, our Office of Emergency Communications, the health department, the mayor's office, and everything else, and the other community mental health organizations, because we need to be constantly talking and constantly working together to help people. Here's our contact information if anybody has any questions.
Excellent. Thank you so much.
Hello, good evening. I appreciate being a part of this meeting today. My name is Diane Lance, and I'm the Director of Metro Government's Office of Family Safety. With me also today is Becky Bullard. She is our Senior Director of Programs, who focuses a lot on the work that I'm going to be speaking about tonight. Thank you, Chairman Syracuse, for being incredibly proactive in leading this effort to increase the information sharing and discussions around where we are, what we're doing, and where we want to go in the city regarding deadly violent crime. Metro's office, whoops. Oh, it was a left click, thank you. Metro's Office of Family Safety focuses our mission on victim safety and offender accountability for crimes of interpersonal violence at our two family advocacy centers, where we provide advocacy, training, outreach, and multidisciplinary collaborative work. We do this type of work at our two family justice centers. You can see here that on the left we have our court-based family safety center called the Gene Crow Advocacy Center, and on the right at 610 Murfreesboro Pike is our community-based family safety center called the Family Safety Center. The Office of Family Safety Center focuses on interpersonal violence, relationship crimes, which includes domestic violence, sexual assault, human trafficking, child abuse, elder abuse, stalking, and homicide. 47% of police violent crime calls in our city are calls for domestic violence. That is between 24 to 25,000 police reports a year. 92% of our clients at the Office of Family Safety's primary victimization is domestic violence. Domestic violence in the home impacts children. These 2021 and 2022 numbers show that the majority of OFS clients have children living in the home where the domestic violence occurs, averaging over 3,000 children per year. And that's just our clients, not the 27,000 police calls for domestic violence incidents. CDC data shows the impact on children: 45 to 60% chance of co-occurring child abuse in a domestic violence home, and 68 to 80% of children in domestic violence homes witness the abuse. This slide shows the homicides that occur in our city since 2015 related to domestic violence, and the homicides since 2015 in our city, and what percent are related to domestic violence. In the most recent year of 2022, 18% of Nashville's homicides were domestic violence homicides. Domestic violence homes are dangerous for children, and familicides have become regular occurrences in our city. Since 2017, at least 2 children have been killed in domestic violence homicides each year. We are also in Nashville seeing an increase in newborns being killed in domestic violence homicides, with at least 1 newborn being killed since 2020. The chart on the left that you see shows that Nashville experiences 1 to 2 familicides or multiple murders each year, with an average of 2 victims per homicide incident. The chart on the right shows the increasing frequency of murder-suicides, where the offender kills himself and kills the other person. 3 to 4 murder-suicides since 2017 each year, with each murder-suicide involving an average of 4 victims. Very, very deadly. Domestic violence mass shooters are the most violent, killing far and away the most people in their mass shootings. The deadlier the shooting, the more likely the gunman had a history of domestic violence. Victims in crisis is fundamental to the work that Office Family Safety does with our 24/7 available advocacy services. Many of the victims that we assist are brought to our center by patrol officers with children in tow from the scene. In 2022, OFS had 11,423 client visits. In those visits, we work with these victims on safety efforts to help increase their safety and reduce offender recidivism. We really concentrate our efforts on all of these things, but with emphasis on assessing risk, safety planning, and finding shelter beds. Because not all cases are the same, we focus a lot of efforts on identifying the highest risk abusers and their victims. One tool we use to accomplish this is the lethality assessment. This is an 11-question form that helps patrol officers determine if an offender is reaching a deadly or near deadly level of violence. If high risk is determined by the patrol officer with this questionnaire, patrol connects that victim at the scene with the YWCA hotline, with our office following up at a later date, providing for the first time crisis intervention at the scene of intimate partner violence cases in our city. Our office reviews every single lethality assessment that police do. That is over 7,000 per year. From this over 7,000 laps that are done every year that we review, over 3,000 are determined to be high-risk cases. From those 3,000 cases, our office identifies those cases where there is extraordinary and immediate risk, which ends up being over about 1,200 per year. Our multidisciplinary high-risk intervention panel reviews each of these cases in their weekly multidisciplinary task force meetings. That includes police, prosecutors, courts, probation, parole, and shelter providers. As you can see, firearm use and access and stranglers are some of the most common high-risk concerns that we have. Our third approach to this issue still focuses on high-risk indicators, but we really zero in on 2 of the most deadly indicators, firearms and strangulation. To do this, our office digs into every single criminal defendant, domestic violence criminal defendant, and order of protection respondent's background. That's over 10,000 cases that we do deep dives into to flag abusers that have a firearm and or strangulation histories. In 2022, we found that 49% of these abusers have access or have used a weapon against their victim, 39% have a history of strangling that victim or past victims, and 22% have a history of both firearms and strangulations, a very deadly combination. Since 2012, guns have been the weapon of choice in domestic violence homicides, far exceeding other weapons such as knives, blunt force trauma, and strangulation. However, strangulation, blunt force trauma are often precursors to gun-related homicides. This chart shows the number of abusers who killed with a firearm from 2018 to 2021. What's really important about this slide is that the red guns indicate gun homicides where the killer had a conviction or active order of protection that prohibited them from owning or possessing a firearm. Because we are seeing domestic violence homicides committed with guns by abusers who are prohibited from possessing a gun, we dug into the issue further and found that from 2018 to 2020, 36% of those offenders that committed a domestic violence homicide with a firearm were prohibited by law from owning or possessing a firearm. Because we can only search Davidson County criminal records, we are certain that number is likely higher. This issue brings us to the significant gaps in firearm dispossession laws. Under Tennessee law, those who cannot own a firearm include anyone who's ever been convicted of a felony, anyone who's ever been convicted of domestic violence, anyone who has an active order of protection against them, and anyone who has been dishonorably discharged from the military. If someone falls into one of those 4 categories, they must dispossess of their firearm. That dispossession involves relinquishing all firearms within 48 hours of conviction or the granted order of protection, and turning in a firearm dispossession affidavit to the court within 48 hours that states either that they don't possess a firearm or they have dispossessed of their firearm. Violations of this law can result in federal and state charges. Theoretically. There are some loopholes that make dispossession hard to confirm or track. Delay. Because of court delays, it can take up to 2 to 3 months for a victim to get their final order of protection. This time between the temporary and the final order of protection allows an offender to keep their gun at the riskiest time for victims, when they are leaving their abuser and the abuser knows that they are leaving. The entire dispossession process is based on an honor system. If the abuser signs that he or she does not own or possess a firearm, even if a gun was used in the very crime that they were just convicted of, their word is accepted in the court. There are no legislative compliance hearings for these abusers to bring proof of dispossession. These abusers are also allowed to dispossess to a third party in Tennessee with no confirmation from that third party that the offender did dispossess their firearm to them, and 2, that they are allowed, that individual at third party is allowed to possess a firearm, and 3, that the third party understands that dispossession happened and that the weapon should not be given back. This was an issue with the Waffle House shooting in Nashville. The father gave the gun back to the son, who was not permitted to possess firearms from a different state's red flag law. Tennessee is one of only 13 states that allow domestic abusers to transfer their firearms to a third party. And of those 13 states, Tennessee is the only state that does not require abusers to provide any information about the third party or to provide any assurance that the third party is permitted to possess a firearm. Since 2016, our office has been trying to tackle these problems. We formed a multidisciplinary task force around firearm dispossession, which include police, sheriff, prosecution, courts, probation, and the AG's office. We attempted to eliminate the third-party loophole legislatively, but without success. But we do believe that there's hope if more rural Tennessee partners joined us, that we might see progress. Despite this setback, the team created a Metro Firearms protocol and toolkit and helped get court compliance dockets started in our city, which is local movement in the right direction. Here are just some examples of those tools that we use. This one here is a form we use with victims to show us where the firearms are and what they look like. And we also created a bench card for judges to use so it makes it easier to follow the law, and pocket cards for police explaining when they can and cannot seize weapons. Another essential approach in our office takes to violent crime is forming and leading targeted multidisciplinary teams. These multidisciplinary teams do the essential work of highlighting the gaps and problems in our systems and practices and drive collaborative solutions between courts, law enforcement, prosecution, and our many nonprofit partners. All of these teams feed into our office's annual summit to discuss, make progress, vision, and inform on continued challenges that we are facing as a city and how we want to address those. So you can see how everything feeds in on this slide. In addition to our office's multidisciplinary teams, we are fortunate to have many community partners that help us in our work each day. The collaboration between our nonprofit partners, government, and medical partners within and outside our family safety centers have changed the landscape, honestly, of interpersonal violence, victim safety, and prevention in Nashville. Lastly, our office's approach to violent crime is to lead and learn nationally. In 2022, our office trained 9,790 people, adding up to 11,627 training hours on all topics related to interpersonal violence, but always emphasizing high-risk indicators and homicide prevention. Nashville has become the leader in interpersonal violence and family justice center work across the state. We have provided technical assistance to 70 cities, with the most requested topics for assistance being trauma-informed advocacy, strangulation, high-risk work, firearm dispossession, and our fatality review teams. Just last week, our office hosted, through a grant, the state of Tennessee's annual Family Justice Center Conference at Pickwick State Park. In the last few years, our office has twice hosted in Nashville the National Family Justice Center Directors Conference. The CEO, Gail Strack of the Alliance for Hope, that manages family justice centers across the country, was quoted in the news during that conference as saying, "Nashville is leading the movement and should be a required site visit for every community's coordinated response and collaboration in America." Family justice centers are located across the country. California has the most, but Tennessee has the most per capita. Aside from conferences, these are the states that have brought delegations to Nashville to learn from and replicate our court and community-based family safety centers, our high-risk intervention panel, and other multidisciplinary teamwork that our office does in our city. Lastly, there's just one more really important thing I want to say. At the beginning of this presentation, I stated that 92% of our office clients' primary victimization is domestic violence. I said primary victimization because many clients, many of our victims, have layers of victimization in their life. While someone may come to us about a domestic violence situation, a few questions reveal often that sexual assault is also co-occurring, pot trafficking, child abuse, and many other things. That makes sense. In a situation where a victim is being beaten by an intimate partner, it is highly unlikely that that power and control dynamic will stop at the bedroom door. The same goes for violence on our streets. Someone committing the most violent crime on our city streets are not returning home with peace, tranquility, and passivity. The violence always comes home, just as it always starts home. Thank you so much for your time and attention on this important subject.
Thank you, Diane. I believe next we'll hear from our Mayor's Office of Community Safety.
Okay, I'll pull this down. Hello, and Councilmember Syracuse, thank you so much. My name is Ron Johnson, and I am the Director of Community Safety here in the Mayor's Office.
Said he should be in this chair with those long legs. Thank you for your time on this meeting. My name is Brianna Tillman. I'm the Grants Manager for the Office of Community Safety.
What we're going to do, we're going to talk about some of the things that we do here. But before we do that, I wanted to just let you guys hear a quote from someone who I follow, and he said, "The best education I received was working with people in the community on a grassroots basis, because what it taught me was that ordinary people when they are working together, can do extraordinary things. And I really want you guys to think about that as we share the things that we are doing. Ordinary people can do extraordinary things with the work that we're doing in our community. And Brianna is going to start us off.
I'm going to start us off with an overview of the Office of Community Safety through the lens of community violence. This here is a community-governed definition. We asked members of our community collective known as the Village to help us define community safety as it relates to community violence. By reading the definition, community safety is the collective effort to create a peaceful and inclusive environment free from crime and disorder, where residents feel respected, empowered, and safe through education and opportunities for active citizen participation, including access to protective factors and resources, especially for those most impacted by violence. And so as it stands, our office focuses within 3 programs and initiatives that foster community development, violence interruption, and group violence intervention. It's important to note the community's role to supplement policing. Policing alone has not been shown to reduce crime except when combined with ongoing community partnerships. This tells us, and research shows that community-based solutions can reduce crime independently, suggesting that they are the more important role when it comes to reducing violence. Community safety and violence prevention fields aim to support and formalize programs that effectively prevent violence through solutions that are empirically proven to work. Excuse that slight edit with combining our presentations, but it's shown another way. Community development for this office is known as the Village. The GVR program is a partnership with John Jay National School of Safety, and is a partnership with the Urban League of Middle Tennessee. The Violence Interruption Program is based on a Cure Violence Global model out of Chicago and is a partnership with the Metro Health Department, and the Village is a partnership that exists between the Mayor's Office, the Community Foundation of Middle Tennessee, and the Center for Nonprofit Management.
And one of the things that we do a couple of things we do is prevention and intervention. And as we speak, you'll see exactly how we're going to tap into some of those things in making it work.
So community development, again, is known as is a collective of nonprofit partners, and it's a public-private partnership between us, Metro Nashville, CFMT, CNM, and the small grassroots community organizations working in the communities that they serve. Funding has been allocated for professional development training, nonprofit consulting, and workshops via those 2 nonprofit entities that provide capacity building services to nonprofits. So we help them expand their capacity to be able to deliver services to the city of Nashville. Some of those community groups have also been able to receive direct funding from Nashville through a new funding instrument called the Community Safety Partnership Fund. Important to note here is our office is also funded through something very similar. It was established only 2 years ago through this administration through ARP funds that were deployed into the nation in response to the George Floyd homicide. So the mission of the Village is to provide a safe environment for leaders of grassroots organizations from marginalized communities, identities, or lived experiences to thrive, connect with peers, and gain access to resources, wisdom, funding, and power. Our vision for the Village is for it to become an autonomous, community-governed social enterprise which raises the capacity and effectiveness of endogenous solutions to community needs. A bit wordy here is just a bit of research to back our approach in community development to say. There's a renowned sociologist who studied at Harvard and produced a paper called An Uneasy Peace that argued for that most proposals overlook the role of endogenous solutions. So those things that are from the community itself have been shown to be the thing that solves community problems. Most approaches will say that we need exogenous, meaning external things, like such as bringing the police into a community to solve the community's problems. We argue that the community can take care of itself.
And I just to add to that, one of the things that we want to do and what we like and have seen work is giving the community what it needs to the best of our abilities, and the community will be able to heal and solve most, if not all, of their problem. Now, that does not mean that we are excluding anyone. This is just including community a little bit more than we have over the years.
If we could, please. So Sharkey's research shows that just by the very presence of nonprofit and community-based organizations inside of a community have been shown to reduce crime. As the statistic is broken down, it says that every 10 additional organizations focused on crime prevention in a city with 100,000 residents leads to a 9% reduction in the murder rate, a 6% reduction in the violent crime rate, and a 5% reduction in the property crime rate. This idea of collective efficacy or social cohesion, meaning that the community can work within itself to solve its own problems, is something that shows a positive impact on violence. So positive social cohesion means less or reduction in violence. The research shows that the groups who have a hand in reducing community violence and therefore a positive impact on social cohesion are those who focus on neighborhood development, crime prevention, substance abuse support, job training, and activities for youth.
The village.
So a quick show of what it means to deploy resources into communities that need those resources. It was a pilot that deployed last year. It deployed $835,000 in grant funding from the mayor's office into Napier and Sudicum, as we all know, is a public housing community that has long been underserved. Most of the citizens there are living in poverty. Some of the deliverables from those grants deployed into that community include a commercial community kitchen that provides meals to families, a transportation van that allows kids from the neighborhood to go to Rocketown and interact with other kids outside the neighborhood safely, a deli that employs programs program participants who are survivors of domestic violence. And a restorative justice counselor who was born and raised and has raised her own kids in the same neighborhood. She knows the neighborhood well, the residents trust her, and she's now able to provide restorative justice counseling to her own peers. To shift the conversation from community development to the anti-violence programs are just a couple more statistics to build onto what has already been shared about violent crime here in Nashville. What we know is that groups are linked to 34% of recent violent incidents, which means those known groups of people, a small group of people inside of Nashville are responsible for a large amount of violence. Groups are involved in violence range from neighborhood sets to larger complex affiliations, meaning gangs are included but not limited to those groups who are known to commit violence inside of Nashville. Interpersonal connections significantly influence serious violence. There is a strong link between intimate partner violence and gun violence. As it stands, the Office of Family Safety takes care of intimate partner. We take care of community violence. And I'll shift it over to Ron.
And one of the things that we do in the, what we call the GVI, Group Violence Intervention, we were able to partner with John J. College, and then with John Jay, they were able to come down and do what we call a problem analysis to give us a true idea of where a vast majority of violence, where it's coming from. What we were able to ascertain and pull from that was knowing that about 400 and some people in our city is causing what we just said, about 34% of the violence. And in approach, what we've been doing is about 5 or 6 cities around the country that are doing the exact same thing and has had a lot of success in doing so is being very intentional about the services to the particular groups. In other words, what we want to have you understand in our GVI program and approach is we want to keep you safe, free, and alive. But we also want you to know, as a law enforcement, we want you to know that we know who you are, and if your group, meaning your gang, your set, or your group of people who are perpetuating some of the violence continue, that the law will come down pretty hard, not just on you, the individual that we may be talking to, because they may be the one that we've gotten the alert for. It's going to be the whole entire group. And what we found is the group don't want to be known as the group that's causing all of the violence. And so this approach has been one that have made those people in those circles who perpetuate it not commit as much of the violence. But what we are doing also is, and having a navigator, a case manager, someone who knows the community, knows the terrain, build these relationships with these same groups of people and have something to offer, an opportunity. We have people that we partner with for jobs and opportunities. We also, if a young person is a part of that group or organization, we're in a position to be able to try and help and assist in any way we are able to do. With that being said, we want to make absolutely sure that those groups know we know who you are, and we're going to try and provide whatever service we can to try and help you. Okay, and then this next thing we're doing here is in partnership with the health department. It's a Cure Violence, and Cure Violence is it's out of Chicago. The health department is going to be leading that, and they're going to be basically manning that. They'll be talking about that toward the end of the presentation here, about exactly how we're going to be dealing with that. But one of the things I'd like to share with y'all, Cure Violence is based off of people who are maybe form of violence themselves, but also have changed and decided to work with the system, so to speak, or with an organization to disrupt or interrupt violence in its state. In other words, some of these violence interrupters, they call them, will be people who come and grew up in that neighborhood. They will be trained and positioned to be able to disrupt violence before it actually happened, and hopes from that point we can change the behavior that's actually going on. But it's the initiation of violence that keeps us going. If we could stop it from being initiated, that's what a violent interrupter will be doing. And that concludes all of our presentation. If you guys have any questions, we'd be more than happy to answer those at the end.
Thank you both very much. All right. Next, we'll welcome Ms. Vasquez. Thank you so much.
I'd like to begin by thanking Councilmember Syracuse for the invitation to be here with you all today. On behalf of Sandy Hook Promise, we're very grateful for the opportunity. I'd also like to thank the speakers that came before me for the incredible helpful information. And it's very inspiring to Sandy Hook Promise to hear or to gain some insight into what Nashville is doing and what is on the horizon, and give us a sense of what's possible. And on behalf of Sandy Hook Promise, I'd also like to extend our wishes for the entire council and the people of Nashville and Tennessee at large as folks seek solutions and next steps. Please know that Sandy Hook Promise is keeping all of you at the top of our mind and in our hearts, and we wish you much healing and gentle passage through what is going to be a long road to recovery, and a incredibly important opportunity for deep reflection. Sandy Hook Promise itself was formed by individuals, families who lost a loved one in the Sandy Hook Elementary School shooting in December of 2012. Our co-founders, Mark Barden and Nicole Hockley, separately each lost a son. And in response to that tragedy, as they thought about their next steps, they created the organization Sandy Hook Promise. Our mission is to educate and empower youth and adults to prevent violence in schools, homes, and communities. Because our genesis is in schools, our primary focus, but not our sole focus, is in fact on students. And what we know for sure is that when there is a school shooting, that students in the schools within the city are greatly impacted. But so too are students across the state, and due to the connectivity of human beings these days, so too are students around the nation as they hear the stories and see the images in the media. And so it becomes incredibly important to keep students center and top of mind as decisions are made and plans are laid out and opportunities are seized. And so we certainly encourage all of you to do that as you think about your next steps. As it relates to Sandy Hook Promise, we are a gun violence prevention organization at our core, but we have a unique approach to the work we do. We have an entire section portion of our organization that is dedicated to bringing violence prevention programs to students in schools. These programs can also be provided to students in contexts that are not within schools, but our genesis certainly was and continues to be to bring them into schools. To give you a lens on what we have done nationally in this context, you have some information in front of you that gives you a little bit of insight into that. We call our suite of programs, which I'll talk in a moment about the individual programs within that suite. We refer to it as our Know the Signs programs. And the reason we refer to them as Know the Signs programs is because fundamental to what they teach students is how to recognize the signs and signals, the observable signs and signals of someone who may be at risk of harming themselves and others, and then also teaching them what to do next, i.e., tell a trusted adult what you know so that the adults can go about the business of taking the next steps. So nationally, 21 million participants in one or more of our Know the Signs programs. These programs have, we have confirmed 493 lives saved with crisis interventions, and I'll explain a little bit about how that connection is made. Just last month, we confirmed having averted the 15th planned school shooting. And that's incredibly important. And you all are right in the midst of what it feels like to have experienced a school shooting. And so we are very proud that we've been able to prevent at least 15 of those around the country. We offer an anonymous reporting tip line that is student-centric. And to date, 185,000 tips have come through anonymously. We encourage students to use it, to talk about or to let folks know when they need help or when someone else needs help. And the incredible thing about young people, and I'll talk about this a little more when I get into that actual program, is that given the opportunity to help other people, they do. And so we have not seen students misusing an anonymous tip line. And it's incredible to see how ready they are to be what we refer to as upstanders. We've also confirmed prevention of 184 acts of violence with a weapon, so that includes a variety of instruments that could be used. And then in 2018, at the federal level, we passed the Stop School Violence Act. This piece of legislation creates a funding stream that is available to schools or districts, for example, to obtain a grant to help them pay for costs associated with bringing violence prevention education training to students. And so we believe in asking our friends at the state level and at the local levels and our friends in school districts and school boards to make room for violence prevention training, but we would be remiss if we didn't also help these individuals figure out how to pay for it, given that costs are always important, especially in a school context. So we've been able to do that at the federal level. Our impact in Tennessee in general. Tennessee is one of the states that we are getting started in, yet we are proud of our footprint so far. 28,000 supporters across the state, supporters of Sandy Hook Promise in general. 209 volunteer Promise leaders. These are individuals who, after having committed to volunteering for Sandy Hook Promise, then take the next step and want to do a little more. And in particular, they tend to be our local champions of violence prevention education centering students. And then you heard me mention the suite of programs that we call Know the Signs, 78,000 students and adults trained across Tennessee in at least one of our programs, and they have been across, to date, 166 different schools. These are the programs that are in that suite of Know the Signs programs. Our first, and these aren't in order of importance, they're just in the order I put them on the slides. Start with Hello is the program that we have that that touches the youngest of students, starts at kindergarten, K through 12, and it teaches youth about empathy and inclusion, including how to recognize the signs of loneliness and isolation, and how to distinguish a student wanting some alone time. Sometimes we as human beings just want some alone time, and students who are feeling lonely and isolation, given that data shows that students who feel chronically isolated might at some time within their course of in a K through 12 education make a decision to harm themselves or possibly to harm others as well. So this program is centered on that and trying to close that gap. Our Say Something program is kind of what it sounds like. This is designed for students slightly older ages. It's centered in teaching students, again, how to recognize the observable warning signs, especially on social media, of someone who's at risk of hurting themselves or others. And we were deliberate about folding in the social media aspect, given that young people in this age group spend a lot of time on social media. But what we have also found at Sandy Hook Promise is that young people, students in particular, teenagers, know a lot of things, they see a lot of things, and they tell no one but their friends and each other for a variety of reasons. So what we want them to do is to understand that they aren't required to assess or decide if there's a there in a troubling social media post, that all they have to do is let someone know what they've seen in the event the person on the other end or the other side of that social media post is in need of help, and that there are opportunities out there to bridge individuals to help in the moment that they need it or when they need it most. Part of what we do with our Say Something program is to be deliberate about encouraging young people to tell a trusted adult what they know. And a trusted adult is whomever the young person determines is their trusted adult. The point being to give the information to the next person who can move the needle on getting the individual the help they need at that moment. A submodule of our Say Something program is Say Something Prevents Suicide. And this is for an older audience, including adults, and it is similar to the general Say Something program, teaching individuals how to recognize the observable signs and signals of someone who may be thinking about suicide and what to do next to get that person help when they need it most. The third program is our Say Something Anonymous reporting system, and I mentioned that in the beginning. And this is also something that Sandy Hook Promise provides at no cost to schools. And it is a system, a multifaceted system that provides an app, a hotline, a website, in order to receive those incoming tips from students who are themselves in distress or who have observed those, or who have seen those observable warning signs of someone who's at risk of hurting themselves or others. This is tied for Sandy Hook Promise to our National Crisis Center, which is based in Florida and is staffed 24/7, 365 days a year by trained crisis counselors. And I point that out because the people who are on the receiving end of these tips are receiving these tips live. And that's important because if somebody is on the brink of harming themselves or others, and there's a student or a young person raising that concern, you want somebody to be on the other end of that incoming information to help really respond to it and figure out what the best next steps are and who the next person to receive the information ought to be. And so we do that through the anonymous reporting system. And what's incredibly interesting, and this is something I touched on earlier, is that when you couple the option of an anonymous reporting system with the other trainings, with Start with Hello and Say Something in general, young people get it. They get that anonymous reporting is a helping tool. Our data has not shown that students misuse it. Adults often ask and adults often express the concern that an anonymous reporting option will be misused. We understand that. The upside is that students have demonstrated that they're not as jaded as adults, perhaps, because they don't do that. They don't use it to cause fellow students or other young people harm. They use it for what it's meant to do, to get other people connected to help when they need it. And it's incredible to see it happen. Our fourth program is Students Against Violence Everywhere. These are, we refer to them as our Save Promise Clubs. And these are our sustainability model for the trainings. I think that's a great way to describe them, meaning we are committed to creating space and holding space and institutionalizing space for students to become leaders in this whole idea of ensuring that their schools are safe and welcoming spaces. And we've discovered that one way to do that is to provide them with the training and then give them the opportunity to take what they've learned and translate it into activities that they can do year-round in order to sustain the learnings of those trainings and to really turn to a kind of peer-to-peer training model, student-to-student training model, so that the learnings become institutionalized in those individual schools and can help shift the conversation on a long-term and permanent basis. The key features of our programs here, we refer to them as being evidence-informed for the purposes of the federal grant that I mentioned earlier. That grant has a definition for evidence-based. Our programs also meet that definition of evidence-based. The definition is not in this presentation, but I'm happy to share it with all of you later if you'd like to see what that is. But researchers have followed our programs to see the effects, and we're happy to say that the research has proven that they are, in fact, effective at teaching youth and adults how to prevent school violence, shootings, and other harmful acts. Through the programs, students and educators learn, as I said, how to identify those at-risk behaviors, and equally important, the why and how to intervene to get help. And as we all know, early prevention measures empower everyone to keep schools and their communities safe. The programs are provided in these 30 to 40-minute windows, so they can be done during a classroom period, for example. And we've Sandy Hook Promises has created them that way intentionally. They align with CASEL competencies, and they're transferable, meaning they don't only have to be taught within a school context. They can be taught in community groups, for example, who might have a student-centric service model and have access to students. They can certainly be taught there. And the particularly interesting thing about our programs, as I reflect on what speakers before me said, in particular, the conversation about community-based efforts, and I wrote down a quote here of giving the community what it needs, is that the content of our trainings are informed a great deal by what students have told Sandy Hook Promise they need and want. And for them, the bottom line is that they want the opportunity to learn how to prevent violence from coming into their schools. They've made it very clear to us that adults tend to think about teaching them what to do in the moment that a violent act unfolds within their schools or in close proximity to their schools. They want to know what they can do to prevent that from happening in the first place, and our programs are really good for that. The second part of our emphasis at Sandy Hook Promise as it relates to meeting youth where they are and positioning them to be able to prevent violence in general is engaging them and teaching them how to become policy advocates. I am on Sandy Hook Promise's policy team, and we're a small team, but we have a strong commitment to helping to create the policy advocates who will replace us in due time and do a better job than we even dreamed we could possibly do. We think that is part of our professional responsibility and part of our human responsibility to the young people, and we will bring that to the youth of Tennessee and in Nashville with every last ounce of our expertise and commitment. And as part of that, we're committed to making space and holding space for unlikely advocates as well. And by that, we mean young people who have possibly never even dreamed of or thought of the fact that they too can be policy advocates, that they too can help frame how policies are structured, that they too can help write policies. Like I said, we sit down with students and they tell us what they see what they see in terms of the real life effects of the policies adults write, and they tell us what could be better, how things aren't working as well as they could, and then we are deliberate at Sandy Hook Promise about writing their concepts and ideas into the policies we craft. And it's incredible, but not all adults are comfortable accepting the ideas of young people as being informative or even framing what an actual policy solution is going to look like. So we encourage that across the board from everyone. And these things we're talking about are doable in Nashville now, right? Your schools could choose to incorporate violence prevention training now. They could apply for a grant at the federal level if they need it and bring this in now. We could commit collectively to holding this space for young people now and having them help us craft the policies that are best for Nashville and indeed policies that are best for Tennessee before the legislature if that's what they choose. We have a suite of youth advocacy toolkits that are, as we say, subject matter centric. They are not about a specific piece of legislation or a policy, but rather designed to teach young people how to talk about critical subject matter. And I'll give you the examples of what they focus on. They focus on teaching young people how to talk about why temporary transfer of firearms away from people on the brink of crisis is a valuable and important thing to do. Teaching them how to talk about why secure storage of firearms is an important and valuable thing to do. These things can be done without an actual law in place. Young people can certainly talk to the grown-ups in their life about why it's important to do these things, why it's important to ensure there are completed background checks on firearm purchases, why secure storage of firearms, for example, is a good approach to suicide prevention, a good part of that calculation, for instance, and how to talk about adults in their schools, to their principals, to their superintendents about the fact that this funding exists at the federal level that their schools could apply for in order to bring these opportunities directly into their schools. So I encourage all of you to visit our website and access this information so that we can collectively start to integrate young people into the conversation without waiting for there to be a particular policy on the table, be it at the local level or the state level. And lastly, if anybody wants to be in touch with me or my team or wants to have a conversation with anyone else in the Sandy Hook Promise team, you can reach my team here and we'll be happy to connect you to the next person you'd like to speak to at Sandy Hook Promise.
Thank you so much, Ms. Vasquez. That's fantastic. If you like, you can stay right there, and we do have a mic here that, as questions come, that you can all kind of share that mic. And yes, Doctor, right. I will open it up to council members. The first hand I saw was Councilmember O'Connell. Then I'll come over here to Councilmember Swope. Go ahead, Councilmember.
Thank you, Mr. Chair. Really appreciate this session. Thanks for stewarding this important series of conversations as we grapple with it. And I guess my first question is, based on this presentation, is this, are any of the programs from Sandy Hook Promise currently in effect in Nashville?
Yes, I don't have the list with me, but we have done an assessment, and there are some schools that are using at least one of our programs. There's maybe one or two in Davidson County. And again, we're just getting started in Tennessee, but across Tennessee, we have trained students and adults in approximately 166 different schools. And if you're interested in the list, I can always produce.
Great, we can get that as follow-up, but thank you. And then I think as we understand more of that programming versus what's available and cost, those kinds of things, I think it'll be helpful to know where we go from here. And then, Mr. Chair, my next question is for Office of Family Safety and Diane and her team. The question, I guess, is the data about specifically people who should not legally have firearms that still continue to possess them. This reminds me a little bit of the scenario where we are confronting an epidemic of guns stolen from vehicles in Nashville and can't even legally issue citations for that. I feel like as I sat through that presentation, there's a little bit of helplessness to it. Is there anything that we can do under current state law locally that we are not doing to better address that problem? Thank you.
Hi, thank you, Councilman. My name is Becky Bullard. I'm the Senior Director of Programs with the Office of Family Safety. And without legislative changes, some of the things that we've been working on over the last several years is a firearms dispossession protocol. And with that protocol, it works under state law, our unfortunately somewhat vague state law, to try to iron out what the steps are at every point in the process. And so that would be with our emergency services department, with law enforcement, with our advocacy services, with prosecutors, probation, and the courts. And so some of the things that we can do under that state law really rely on judicial discretion in utilizing some of the laws that we have in place to do appropriate search and seizures for those individuals. So some of that really looks at making sure that we are working on being in compliance with the state and federal laws by going through a dispossession process whereby the courts are making sure that that third party is being held to account, that the individual, the respondent or the defendant in these cases is who is saying, I don't have a firearm, where there's evidence that they do, that is being considered by the courts, by police, and by prosecutors to follow up on that and potentially look at search warrants. And then also to make sure that that individual is even filling out our affidavit of firearms dispossession, which is required by state statute. So some of those things are ways that we can kind of cover the gaps that we find in the state law.
Am I hearing you say, though, that most of the steps there that you're talking about exist within the judiciary?
Yes. So there's the judicial discretion that we rely on due to the nature of the state law indicating that someone can dispossess by any lawful means, including a third party. And that really brings in judicial discretion around having a compliance hearing and following up on whether or not that dispossession process actually happened and if that third party is a lawful party to dispossess to.
Great, thank you. And I think it's striking to me how similar some of the application of that program is to what the group violence intervention approach that's happening in the Office of Community Safety is. And Mr. Chair, it may be worth figuring out if we can do some reporting or benchmarking to help the city understand when and whether we're making progress toward implementation of that protocol. So thank you very much.
Thank you, Councilmember. Councilmember Swope.
Thank you, Mr. Chair. Thank you all for being here and your presentations today. It was quite enlightening. I just have one specific question, and this is to the Mental Health Cooperative. You had mentioned that, and I'm assuming when someone's determined to be a 404, it's basically an involuntary mental health commitment, right? Who makes that determination?
Thanks. They're master's level trained clinicians who are licensed and are certified as a pre-screening agent, that they can make that determination. So that's the first level of commitment. When they're sent into the hospital, and the second level of commitment is then made at that time.
And the second level, I guess my question is, does it ever reach a judicial decision?
It can. Yeah, sure. I'm going to hand it over to Michael. It can at that point. It's after a certain number of days and level of treatment.
I believe it's 5 days, and then the consumer goes in front of a judge for a probable cause hearing, and that would be the judicial commitment. That's a little outside the realm of the crisis care that we provide, but you could direct any of those questions with the Department of Mental Health because they control more of that.
Great, thank you.
Thank you, Councilmember. Councilmember Cash, the floor is yours.
Thanks. This was very informative. I appreciate all the groups and different stakeholders that shared all this with us. This data and the resources and investments that we're making, I think, we got to keep it up and keep working for preventing and being proactive about stopping violence, gun violence, and preventing these things from happening. I kind of came in with a question that is a little different from the proactive, preventative measures that a lot of what we were talking about today. And if this came up in one of the other meetings, let me know, and we don't have to go real deep into it. But my wife had a training. It was she's a preschool teacher, and Brink Fiddler, who was the trainer at Covenant, trained them, and she was, it was traumatic, but it was moving for her, and she got a lot of good stuff out of it. And one of the things that they spent time on in her training was that she didn't expect was if there is gun violence and there are students or school personnel that are injured, how well prepared are we to address that, especially as we're waiting on, EMT or ambulance or MNPD. And I know that there's been some MNPD trainings to better address stuff like that. But I'm just curious, and I guess I want to ask, I know Mr. Brahm is here and Mayor's Office of Family Safety. So I guess I'm wondering, what efforts in that regard have taken place? I know when I was a teacher, we did lots and lots of drills about how to react if there is an emergency, if there is a situation. But I don't recall kind of these medical needs being addressed. So I'm wondering if that's in our plans and kind of who's responsible for that for the city.
Councilmember, I will take that from the health department standpoint. Before these meetings started, during COVID, I worked a lot with a lot of the child care centers. And so shortly after this happened, I reached out to a number of them. We've held a similar event at the health department for the child care providers. I think the training depends upon the individual. What I've learned is that the training depends a lot on the individual program or business that's doing that. But there is something called Stop the Bleed. We do that and we train that. And it is what to do, how to stop the bleeding in the interim between the event and when EMS and others get there. And it's taught in hospitals and other places also, doctors' offices, et cetera. But I think that's probably some of what was included in that. I know that police, fire also do other additional trainings. And so it really, though, depends upon the individual and the resources and how hard they look for things. But it is definitely not consistent across, and that is one thing, because I've been working with them, that we've identified.
And I know, correct me if I'm wrong here, but the school nurses come out of your department, is that right? And
they do.
Do they have training in this area? I know it's not something they're going in expecting to do, but
yes, they do get some training in this. Unfortunately, in a school shooting, they're generally the only medical person within the facility initially. So we hope that they're not involved in the shooting itself and can assist with aid. But it is good to have others trained within that where we can.
Thank you.
I was hoping I might be able to say one thing in addition on that. So I know you're talking about the immediate aftermath when you're waiting for police and ambulances and things like that. But there's also obviously, as you know, the ripple effects afterwards and the trauma that everyone has experienced in the immediate situation, the periphery of people that know or related to people, and then beyond that to a community, and just the overall traumatic impact. And one of the things we would like to see, so when you look at a shooting or other mass casualty event, police will notify their family intervention programs. Great program, the most experienced trauma responders to the emotional needs of victims and those affected, probably in the state. So excellent, but they're a limited resource. We do have a lot of people in our community who are trained advocates, therapists, and things like that, but they have not had the NOVA training that would train them and equip them to be able to respond to a mass casualty event. And so I think that really needs to be a priority for our city is to get these folks who have these skill set and trauma trained on the NOVA training, as well as to ensure that the police family intervention program has enough resources to be able to really quarterback that situation, who to deploy, where to deploy, and how they're needed.
Thank you for that. I completely agree. I think that is vital, and I hope we do improve on that. Thank you.
Thank you, Councilmember. Back to Councilmember O'Connell.
Thank you, Mr. Chair. This is a follow-up for the Office of Family Safety and thinking through the limitations I think we know we have in responding under state law. I guess I think about this now as a preventive measure too. Does your office, this seems like a great forum to figure this out with the general public. Are there practical approaches that we can offer by way of just guidance, education, and advocacy that your office offers that should be more broadly shared, considering the limitations we know we face under state law? And I'm thinking specifically for known victims, potential victims, the kind of the at-risk community.
I think education around the lethality of firearms is really important. And some of the things that our other wonderful speakers said today about really the imminency of danger with a firearm just in the home, for suicide, for harm for children who are accessing unlocked firearms, to individuals who are already in an abusive environment and that firearm just being ready and lethal and available. So I think giving the public a better understanding of the risk that is posed in multiple situations and the risk that we see from research when we already have existing abuse in a home that increases such a high likelihood of lethality from that perpetrator. So that's something that we do quite a lot in our education with victims, even those individuals where there may not be a firearm currently involved in the situation. We want to make sure that they know if at any time that does become introduced, they're at a much greater risk. So we do safety planning around firearms, and if the individual has a firearm in the home, some of the tips and understanding what to do around that firearm if you're being shot at, what to do when that might occur, and also just really understanding the laws that we do have, even if there are laws that are very difficult to implement, that they certainly do have the ability to tell us this person has firearms, this is where they're located, and I want to make sure that that's passed along to police partners so that those guns can be removed. So we try to provide every educational opportunity we can, and then also access points for them to access the criminal justice system if they'd like to help with that firearms removal.
Yeah, and Mr. Chair, I think given that it may be that this committee finds a way to recommend, particularly for October, during Domestic Violence Awareness Month, as a focused opportunity to offer more materials that maybe the incoming council can work at a district level to, work with your office and partner to target materials in a way that is appropriate for general public and during that awareness period, because I think district council members can really help with distributing in a focused way. We've seen a lot of success with that over the past several years, so would love to figure that out with you all. Thank you.
That would
Thank
be
you,
great. And just to add, if I may, really quickly, we did recently have an awareness day around strangulation. Councilman Syracuse, I'll just pass that resolution, and it was really impactful and effective for, I think, the ability to reach out and to talk about the lethality of these things that people have normalized. And, you know, we live in a state where guns and gun accessibility is very much normalized, and making sure that people understand that risk through an awareness campaign, through these, you know, kind of efforts that we can have in our city to make sure that we are a safe city for people, that we are a city free from abuse, is something that we would love to see from the perspective of our office, is having a city that's really coming together around that.
Well, thank you, and I will just state, for my part as an individual, I reject the idea of normalizing it. I want Nashville to be a safe city, and I want us to take very seriously that notion of lethality. And Mr. Chair, let me know how I can help. Thank you.
Thank you, Councilmember. Councilmember Nash, floor is yours.
Thank you, Mr. Chairman. The Safe Schools program seems to be perfectly suited for going for a school board to adopt and push out into the classrooms. Have you had any success with that anywhere where it becomes part of a curriculum and
We haven't had those conversations here yet, but we hope to have them. But we do that. Sandy Hook Promise does that in a couple of ways. One way we do it is that my team passes legislation at the state level that basically institutionalizes this type of training for students across the state. We take that approach because we believe it's important to avoid inadvertent inequity, meaning access, right? We want all students to have it. But even where we have not yet passed a piece of legislation, the team at Sandy Hook Promise that designs the curriculum, and many of them, by the way, are former educators themselves, but the team that designs the curriculum and knows these trainings inside and out have conversations with either districts or school boards about integrating the programs into. So, for example, there are the 166 schools across Tennessee that have had our programs. Somebody in those schools has had a conversation with somebody on our programs team about that. In other states, for example, in Florida, where we are in Miami-Dade, which is pretty large, those conversations were had between our programs teams and the decision makers there, school boards, superintendents, whoever's going to make the ultimate decision of integrating programs. So there's a variety of ways to do it, and our folks will seize the opportunity that's most immediate. But I know they are interested in talking to the school board about opening the doors to making these programs available to students in Nashville.
So I think I heard a yes somewhere in there.
Yes.
You have locations where school district has picked up the program.
Yes.
And
yes. Mm-hmm.
Thank you, Councilmember. Any other Councilmember with questions, comments, discussion? Well, this has been a very robust and cohesive presentation. I want to again thank you, everybody, for the extraordinary work and time that you spent in putting this together. Absolutely. Thank you. So as I said in the beginning of these three meetings, this is just a beginning. I think we've learned a whole lot during these three meetings, and it has helped to focus our efforts on how we can be supportive of our metro departments and our partners across the country. So, Ms. Vasquez, thank you so much for coming down here. We will be staying in touch. We will be continuing to learn from you and find ways that we can continue to partner. So thank you, everybody, for being here. I really appreciate it. And we stand adjourned. Thank you.
This This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information on this and other programs, visit nashville.gov.